If you want to see how high scorers are applying their ethical skills in the situational judgment subtest, this is the video for you because I'll be doing a full-timed situational judgment mock subtest for you to see how I'm thinking. My name's Emil, I'm a second year medical student studying at Monash University, and this is the 10th video in my UCAT crash course series sponsored by MedEntry, who I'll talk a little bit about later, but without wasting any time, let's just get straight onto the subtest. Okay, so as usual, I've got the MedEntry question bank up on the screen. Might as well just get started with the situational judgment mock. So I'd just like to say, this is the second last video of this UCAT series. So thank you all so much for your support throughout this series. I've gotten a lot of nice comments on the videos and I really appreciate it. So the next video will be the last video and it will be me doing a full UCAT mock. So definitely comment, like, subscribe on this video so more people can see the channel and more people can see the mock, and overall it can help more people. With the situational judgment subtest, usually I find that it isn't as time pressured and it tends to be more of a chillaxed subtest. So probably we'll just take it easy during this 1 minute because you're almost there, it's the final stretch. Okay, so Dr. Gopal is a junior doctor working in general practice. He's seeing a patient, Stephen, who recently experienced a seizure. He's waiting an appointment with a specialist. Must not drive for at least 6 weeks and longer if they have not been evaluated by a specialist. He lives in a regional area and is dependent on his car. Stephen states that he cannot afford to stop driving. So how important is it that if Stephen were to drive, he may place other road users at risk? Yes, this is very important. Probably the most important thing in this scenario. And Stephen may be under financial pressure if he's unable to drive. I think this is between B and C. It's basically a way up of whether you think the danger to other people is, I guess, more or less important than the importance of his financial pressure. So I think this is probably C when you put it that way. Sahil, a student, is captain of his university soccer team. One of the members of the team complaining that another member has been selected. Despite him not being as proficient as other teams, yeah, unfairly selected. Sean's father is one of the coaches. Sahil disagrees. He's a skilled member. Sahil's deciding whether to include Sean in the team for the next match. Okay. How important that Sahil and Harry disagree on whether Sean is a skilled member of the team. So I'd say this is definitely on the important side. I'm not sure whether it's very important or important, I think. I'm thinking that it's important just because it's not the main issue. The main issue is about who's being selected in the team. Sean's father is one of the coaches. That's not important at all. You shouldn't consider that when deciding how to respond. Harry is not a particularly skilled player. Again, this is not really important at all, I don't think. Yeah, this is not important at all. Overall functioning and performance of the football team. It's very important. It's a main consideration here. Medical students working on hospital placement. Take blood from a patient. Withdraws his hand and inspects his finger. Needle stick injuries must be formally notified. How important is it that Alex tells Renee it was only a minor injury? This is not important at all because it's a very serious injury that's happened. The other two students have a tutorial to attend, which is already commenced. This is not important as well because this is a big issue that's occurred that needs to be rectified and needs to be reported, so it's not important at all. Jonathan has found that one of his tutors frequently sets students out of work. Other tutors rarely set students to tasks. Interferes with his study for other subjects. Not particularly relevant. trying to decide whether to raise his concerns. Okay. So that Jonathan doesn't feel that the tasks are very relevant to his learning. So I'd say this is on the important side because that's the main issue. But I don't think it's very important because if they've been set, they probably are important in some way, even if he doesn't realise it. Jonathan feels the tasks are interfering with his study for other coursework. So that's very important. The other tutors at the university rarely set students similar tasks. So this is probably on the not important side because it's not really relevant to the issue. But I think it's slightly important because that is a nice comparison for this tutor. Junior doctor is seeing a patient in a hospital clinic, long-term medication. The patient has not attended the clinic for over a year, not had the required blood tests, and has now he's gotten a complication. So how important is it that the harm is caused likely due to non-compliance and therefore he's to blame? That's not important at all. Just need to fix the situation. Hospital may need to improve its system. Yeah, that's very important. So it's just a place for improvement. The patient has seriously had a serious type of blood cancer in remission. Results are not conclusive, and this is a junior doctor as well. A procedure will definitively inform the team regarding the diagnosis. Ask Daniel if the cancer has in fact returned. Okay, how important is it that the tests which have been performed so far are not definitive? So that's very important because then you don't actually know. That Mrs. Wan is anxious, so this is very important to consider as well. It's important to consider the patient's feelings. Students who live in the same area travel in the same car. Marie used to be the driver, but her car recently broke down. Stephen's borrowing his father's car, and Stephen tends to drive aggressively and dangerously. Maria is trying to decide whether to raise her concerns with Stevens. So how important is her physical safety? Yeah, it's like the most important thing. That if Ria raises her concerns, she may no longer be able to travel in the car and save on petrol costs. So this is like definitely not important, but it's just a matter of whether you think, how bad is it that he's driving aggressively and dangerously, and does that outweigh the like traveling in the car and saving petrol costs? So I'd say it's not important at all because safety is most important. That Maria's car will be fixed within a week. I'd also say this is not important at all. She should still be safe. Okay. Anath, a medical student, is at a pub. He sees a patient. Mental health disorder. He spent a significant time with the patient. The patient wants to buy him a beer. So that Anath previously treated him in the hospital, so that's very important. You have to maintain professionalism. That they got on well during the hospital stay. So this is definitely on the non-important side because it doesn't matter. He still can't accept a gift from the patient. So I actually think this is just not important at all. That he'll not be working at the hospital again until Monday. So yeah, this is not important at all. Still has to be professional. That he was admitted to the hospital with a mental health disorder. So this is on the not important side because you wouldn't accept a gift from a patient otherwise, but it's probably slightly important because this might make it more important to consider that. Okay. Poppy's a university student who's preparing for her end-of-year exams. Anna reveals she's finding it increasingly hard to cope. So stressed she's considering self-harm. She has a dark sense of humour and suspects she's joking. However, she also knows that Anna found last year's revision period to be stressful. How important is it that if she takes a comment seriously, she may think that she's overreacting? Not important because the comment is dangerous enough to warrant that. She's not self-harmed before. That's not important. Again, same thing. Stress may have a negative impact on her exam. That's important. Okay. Harriet is a senior medical student. Take a blood sample. Experience of the procedure. Warns her that Harriet has a reputation for being clumsy. Harriet can see the junior doctor is joking, but the patient looks visibly nervous. How appropriate each of the following responses. Tell the patient not to worry because the doctor is joking. This is probably appropriate because it does try to, actually I'm sure, it does try to help alleviate the patient's concerns, but it's probably not good to just say that. Express her concerns, yes, that's very appropriate because it directly addresses the concerns. Inform the junior doctor in front of missing the joke is not appreciated. This is probably inappropriate, might embarrass the patient. Yeah, I'm not so sure about the first one actually, but we'll see. Dr. Steinberg is a junior doctor working in a general practice. Okay. So Andreas seems embarrassed by his mother's comments. She said, so, would you mind if I spoke with Andreas privately? So this is very appropriate, takes him aside, removes the issue. This basically just like completely shuts down the patient, so that's really appropriate. Can you tell me a little bit more about your own experience? So this is definitely appropriate. And I think it's B, just because there's a mitigating factor in that he might not want to talk in front of his mum. This is definitely inappropriate because it's rude. Yeah, I think this is just rude, so it's D. As a quick break from the subtest, I'd like to thank MedEntry for sponsoring this series. MedEntry is the UCAT preparation platform that I used when I was preparing for the UCAT, and I find that they have questions that are most similar to the actual test. They've just launched their new LMS platform, which has skills trainers and interactive curriculum, over 1,000 questions for you to use to practice, and over 20 mock exams for you to use as well. So sign up using the link in the description box down below to get 15% off their online or platinum subscriptions. She's been caring for a patient who's recently started new medication, not supposed to smoke, sees Harry smoking near the hospital entrance. Patient asks, okay, I'll have to inform Dr. Johnson as he is my supervisor. So I think this is very appropriate. Because yeah, as a medical student, you have to tell your supervisor because she's just a medical student. This is, I think, for the same reason, very inappropriate. This one's good. That one was good because it like explores the patient's concerns. Joanna. Mental health disorder. He was physically assaulted by a member of the nursing staff. Okay. Further assess mental state. Decide whether his claims are likely to be true before deciding how to respond. So I think this is definitely inappropriate. Because she's a medical student, she shouldn't just do this. This is a very serious accusation. So I think it's C because she's doing something to address the situation. Informing that this is definitely no, so you should always take these things seriously. This is also very inappropriate. Take this thing seriously. This is A. Report the issue to the nurse in charge. That's also A. Bumps into damages the car park in front of it. Liam notes down the license plate of the driver. May miss his examination. So, attend his examination and return later. So this is, I think it's appropriate. Yeah, I think it's very appropriate. Because it solves the issue basically it's a nice compromise. Call the local police station, it's also very appropriate. Attend his exam, nah, that's definitely not right because you should do something about it. Leave a note on the damaged car with the offender's license plate number and his own phone number. Yeah, that's perfect. Fixes both problems. Okay. A medical student shadowing a senior trainee. High performance in his final exam. Higher than it should be. Raises her concerns with Martin. He thanks her for pointing it out. He simply changes the dose. Okay. Inform him that what he has done is misleading. Yeah, that's true. Just call him out on the behaviour. That's probably right because it's in private and I don't think it's in front of the patient. inform the senior doctor on the ward that Martin has behaved unprofessionally. So I think this is definitely inappropriate. Not sure whether it's C or D. I think it's D because like she hasn't done anything to ask Martin why he did what he did. Monitor the situation. This is, I think, C because it does something to deal with the issue, but it's not immediate, so it's like overall inappropriate. Do not take any further action. That's very inappropriate. Clinical year, significant time on placement. Sally volunteers for the straightforward tasks, and they finish at the same time. It's unfair. Okay. How appropriate. Do not raise the issue with Sally, so that's very inappropriate. You should always bring things up. Mention the issue to junior dentist. I don't think this is A or D. I'm thinking it's C just because it's better to deal with it locally first. Discuss Howard's observations with Sally. Yeah, that's very appropriate. Mention the issue to other dental students. I think this is a D because he should just ask Sally about what's happening. Alicia is attending a family gathering. Robert says he's due to undergo an operation to remove his gallbladder. Feels that keyhole surgery leads to better post-operative outcome. Recommend that Robert undergo keyhole surgery. So she's a medical student, so this is very inappropriate. And also doctors shouldn't do this either. Therefore, unable to offer any information. I think this is very appropriate, although maybe she could give him some sort of information, but I think it's A. Tell Robert she cannot comment as she's not a doctor, can provide some general information. Yeah, this is definitely A. Advise Robert to speak to a surgeon. Yeah, I think it's A. This is a dental student is on his way to a tutorial, which is taking place at a dental hospital. Previous week, he was late to the tutorial. Is this walking upstairs to the floor, and he sees a visually impaired man struggle to navigate the stairwell. This is a pretty common scenario. Apologize to the man and state he cannot do anything as he's running late. Definitely D. Should definitely help. Continue tutorial as it's likely someone else will arrive. It's also D. Should definitely help the man in this situation. This is very appropriate. This is exactly what he should do. Consider how you can ensure you arrive on time. That's definitely very appropriate as well. Felicity is on her way to the train station. She's going straight to an important rehearsal. She notices a person on the ground. She says if she stops to pick up the wallet and return to the university's lost and found office, she'll miss the train and therefore part of the rehearsal. Pick up the purse, continue train station, return it to lost and found. Yeah, I think this is pretty good. Ignore the purse, definitely very appropriate. Pick up the purse, hand it to a member of security. Yeah, that's very appropriate. Anthony, medical student, is approached by his friend Mike. Mike's studying engineering and has a younger sister who says she's interested in studying medicine. He's surprised that Rosie is interested in medicine, has a passion for music, shy person. Under pressure. Okay. Do not mention his concerns and instead provide advice on the application process. I think this is on the inappropriate side because he should mention his concerns if he cares, like if he has Rosie's best interest at heart. But I think it's not D because he is still giving her some advice. So let's see. I'm not sure about that one. Ask Rosie about her reasons for wanting to pursue medicine as a career. Yes, that's very appropriate. Inform Rosie that it's important that she pursues medicine because she wants to, not because of pressure from her parents. This is kind of like assumptive. It assumes that she's being pressured by her parents. So I'd say probably between B and C, probably C. Actually, I think it's B just because it's overall probably helps her to say that. Miranda is attending a lecture. The lecture is being delivered by a guest professor. Content of the lecture is important. Professor arrived late and she feels that he's rushing through the content, making it difficult for her to understand what he's saying. The professor doesn't seem interested in answering questions either. So most appropriate, I think, will be definitely to approach the academic unit. So that's like the formal way to deal with your issues. Ask questions during the lecture. Ask other students. I think asking other students is probably the least helpful, just because they won't necessarily know anything, whereas the lecturer, at least, even though they're not answering questions, they can probably answer it better with better knowledge than the students would. Large leg ulcer, if his leg will have to be amputated. He might need to file for bankruptcy. That it's very likely that his leg will have to be amputated. So it's definitely she should definitely not say that amputation is a possibility, because she's a medical student and she doesn't actually know that. Then I think telling him that a doctor will need to assess him is probably the best, because that's definitely just how it should be in general. So group coursework project, and the project must be completed. They believe the project is a waste of time. When Tom adds his contribution, Jacob notices that he's been copied from a website. Okay. So talk to the tutor about the attitude of the group. Talk to Tom about the concerns he has about his work. Add a reference. Okay, definitely don't add a reference to the content. And then I think, yeah, talking to the tutor is definitely the most appropriate, because it deals with the issue. Talking to him about the concerns that Jacob has regarding his work is good, because it deals with it at the level and asks him why he's doing what he's doing. Aaron is shadowing a surgeon. It's his girlfriend's birthday and they have dinner planned that evening. The procedure is more complicated than expected. Aaron realizes that if he does not leave immediately, he will be late to dinner. He's very busy with the procedure. Okay. So I think asking the doctor for permission to leave is probably the best. And then, yeah, leaving without telling the doctor is probably the worst, because I think then the doctor might be really confused as to where he went, added extra stress to the procedure, and then possibly cause trouble. So we're pretty much done. We have like 5 minutes left, so I only have one flagged question. We'll just have a look at this. Yeah, so this one about telling the doctor not to worry because, telling the patient not to worry because the doctor is joking. Yeah, I think this one's appropriate. Not so sure. I think overall the subtest went well, so we'll submit our answers and see how we went. Okay, so you can see we've done really well on this subtest. So I'm very happy with this, and as usual I'll go through the answers to the questions that I got wrong, and feel free to pause the video and read the explanation for those answers so that you can understand why I might have gotten those questions wrong. If you've enjoyed the video, make sure to like, comment and subscribe to make sure you catch the next video in my UCAT crash course, which will be me doing an entire UCAT live.